Welcome to Gate City Insider. I'm Rosemary Plybon. Today we want to talk about all things COVID-19, from exactly what it is to what to do if you need help, both if you're not feeling well or if you need help economically because of these difficult times, and if you can give help, how you can do that. So we have a series of guests with us today to talk a little bit more about that, starting with Dr. Bruce Swords, who is the Chief Physician Executive for Cone Health. Thank you so much for being with us.
Great. Thanks for having me, Rosemary.
Let's start with just kind of the basics. Can you explain what exactly is COVID-19? What do we know? What don't we know?
Sure. COVID-19 is a virus. We probably have all heard that, and it belongs to a family of viruses called coronavirus. And coronaviruses have been in existence forever, and it's very likely that all of us have had a coronavirus sometime in our life, and it's just the common cold, runny nose, cough, maybe a little bit of a fever. And so most coronaviruses are not clinically all that significant, and this one is novel, it's different, and we've all seen the impact of this novel coronavirus.
So since it is something we've sort of seen before, the type of virus before, does that give us any clues on treatment for it?
We know a lot about the coronavirus family, and this is the first time where I think it has been a clinical imperative that we have to develop treatments for it and have to develop a vaccine for it.
So right now, what is the treatment for COVID-19?
It's all over the map because the symptoms that people demonstrate with COVID-19 are all over the map. So there are people who have no symptoms at all. They're infected. They can transmit the illness, and there's no reason to treat them. So that's one end of the scale. On the opposite end of the scale are people who are critically ill in intensive care units, intubated on ventilators. And for those people who are critically ill and even moderately ill, the treatment really is supportive. So IV fluids, oxygen, supportive treatment, that's really our mainstay. And there have been lots of potential medications that are in study.
Who should be most concerned?
This is really important. The people who should be most concerned are folks who are older, and we make a cutoff of 65, but certainly the older you are past 65, the more concern you should have. And people who are older and have comorbidities should be the most concerned: lung problems, heart problems, diabetes. And then we've all heard stories about younger people who have become severely ill. And again, in that population, it's typically the people who have a comorbidity or multiple comorbidities, the same ones I just outlined. And then all of us should have some level of concern, because we've also heard stories where perfectly healthy young people get COVID and suffer with it, but that's very uncommon.
So how do we best protect ourselves?
Again, we've become familiar with what social distancing is, and I am more fond of the term physical distancing. I think there are still ways to be social. It's important for us to be social, and it's really important for us to be physically distant from each other, because my ability to transmit the disease to you lessens significantly the farther away I am from you. So this 6 foot physical distancing is really important. There is also some evidence that masking helps, and we're at a point in this pandemic where we're very supportive of universal masking. When you're out in public and you're going to be within several feet of each other, wear a mask. And I'll point out that masks are more important for me to wear to protect you from getting my disease than it is for me to wear to protect myself from getting a disease. So we're really wearing masks protect others from us rather than protect ourselves from others.
Really is sort of, you can almost think of it as a selfless thing to do, to wear a mask for others, right?
I think it's part of what we can do as a community to support each other.
We have heard so much talk about a vaccine and that it's in the works. What should we expect as far as that process, and what does that look like?
Yeah, developing a vaccine is not something that just happens and we know it's going to be perfect the first time it's developed. There's a significant science behind developing an appropriate vaccine. So there are some vaccines that are in human studies now, which is great, and it would be fabulous if they were determined to be effective. But there are phases of trials that every vaccine has to go through, first of all, to make sure it's not harmful, and then down the road to make sure that it's effective and will prevent the transmission of COVID-19. It's possible that a vaccine can't be developed. I think we have to continue to remember that it's possible that a vaccine can't be developed. We've been trying to develop a vaccine for HIV for decades and haven't developed a vaccine.
Okay, so we just have to kind of wait and see on that. Can you paint us a picture of what it's like at Cone Hospital right now?
Yeah, so first of all, Cone Health is doing well. Our staff are in high spirits and know that they're doing great work, the great work that they normally do, and they're doing great work with COVID patients. And that's true across our facilities, whether in ambulatory spaces or in the hospital. I'll take the opportunity to encourage people who are sick and need urgent or emergent care. Please come to the emergency department or contact your physician. Don't put off emergency or urgent care because our hospitals are safe. Cone Health has been lucky to develop its own hospital for all COVID patients. It's the old women's hospital. We now call it the Green Valley campus. So our COVID patients are, for the most part, separate from the rest of our facilities.
And I like what you said earlier, that you can still be social, but you can have physical distance at the same time.
Completely agree.
Dr. Swartz, thank you so much for your time. We really appreciate you being with us today.
Great. Thanks for your time.
And we will be back with more right after this break. Welcome back to Gate City Insider. We are trying to touch on some topics that are really timely now with the COVID-19 pandemic going on. And we have with us now Chris Rivera, Director of Workforce Development for the City of Greensboro. Hey, welcome. Good to see you.
Yeah, good to see you. Thanks for having me, Rosemary.
Okay, let's talk about what's going on right now job-wise. A lot of people are out of work or their jobs have significantly changed. Can you kind of paint a picture for what that looks like for the city of Greensboro right now?
Yeah, not only for the city of Greensboro, but really Guilford County. As one would expect, this pandemic has really wreaked havoc on the livelihood of so many members of our community, and particularly as it relates to employment. We received some early data about a week or so ago that, in the first 15 days of this pandemic, some 20,000+ Guilford County residents had to file jobless claims. As we flash forward, an additional 10, 11, 12 weeks, the state of North Carolina has had more than a million jobless claims filed. Here in Guilford County, it's just been devastating. We're very pleased that, even in the midst of this pandemic, that there are businesses that are still looking to hire.
What has changed for your office during this time?
Everything. Unfortunately, we had to make the decision to close our doors to the public. in the middle of March. However, we did not stop providing services. Everything that we have done since the 20th of March has been remotely or virtually. We continue to engage individuals to provide basic information on how to file for unemployment compensation, albeit that our system is not responsible for that. A high number of individuals are having difficulty getting through or had been having difficulty getting through and just had some basic questions that we were able to answer for them and or get them connected to Raleigh. We've engaged with businesses that have had to make decisions to furlough their employees and or permanently lay them off, and have been providing remote services to get them connected to community resources. And then more importantly, we've been working with individuals that have been interested or expressed an interest in going back to work to connect them with the opportunities that we have found businesses to be offering throughout the pandemic.
So a lot of people are finding themselves unemployed for the first time ever. And
Sure.
could you walk us through the steps you should take if you find yourself in that situation, if you've been in that for a while or if it's brand new to you now?
As the pandemic began to, expand, there was a federal CARES Act that offered additional programs or protections or benefits to individuals that would not normally be eligible for unemployment benefits. And that was more so for your gig workers, self-employed individuals that were not paying into the state wage system. But the CARES Act does provide benefit allowances for them. In addition to that, the CARES Act had provided a supplemental $600 per week for individuals that were eligible to receive state benefits and or the self-employed or pandemic unemployment assistance program to collect those benefits. So individuals should or could go to the des.gov website to file the claim. Things that they would need to have would be employment information. So you're looking for your official employer of record's name, your dates of employment, wages that you have earned, reason for layoff. If you're self-employed, there is some income verification that you would have to provide. All in all, it could take up to 14 days for Raleigh to receive, verify, and start processing or paying your claim. So the first thing that we ask people to do is to pack a lot of patience. 1 million people, filing jobless claims within a 3-month period has completely overwhelmed the system. Raleigh has built capacity to try to, process through that. There was a release, I believe 2 days ago, that there are some 200,000 claims that have been pending for more than 14 days. And so they're prioritizing that.
So be patient and have those documents handy when you do that. What about looking for a job? Should you be looking for a job after you file for unemployment? And if so, how do you do that?
I am a workforce development professional, so naturally I would say that anyone who is willing, able, feels safe and comfortable to go back to work throughout this pandemic, now would be the time. There are certainly a number of ways that individuals could start that process. The first being that you can go to ncworks.gov, and that's the state's online job bank for positions that are available. As the pandemic kicked off, our staff began to reach out to employers to kind of mine information about hiring opportunities, and we stood up on our Guilford Works portal a job section as well as a hot job section. So members of our community can go to guilfordworks.org. There is a link that says apply for jobs or jobs. They can click on that, and all of the positions that we have verified to be available and hiring right now are listed on that site as well. While we are providing remote services, individuals that are looking to go back to work can text the word jobs to us at 336-882-4141. And we have staff that are reaching back out to them within 24 to 48 hours to begin that conversation of employment.
And can you talk a little bit about some of the jobs that are available right now, some of those hot jobs?
Yeah, so it's actually across the spectrum. So we expected to see a lot of temporary positions. So you see distribution companies here in the Triad that are ramping up hiring. Lots of goods are flowing through them. Some cleaning services. So as businesses begin to reopen, their facilities. They're looking for additional custodial staff, a lot of healthcare workers. So I was pleased to see that. Skilled trades, so HVAC, apartment technicians, things like that. So it's really across the spectrum, but individuals that are looking for permanent work, those opportunities there. If you just need some maintenance income to kind of get you through the pandemic for your full-time job to come back, there certainly are some transitional or temporary jobs available as well.
Do you think we're going to see a big rebound? Can Guilford County, Greensboro come back from this stronger than before?
We will rebound. Let me start there. Our economy will not look the same. The number of jobs that we have lost may come back. They will look different. They will not come back in the numbers in which we have lost. I have a high level of anxiety of what's going to happen to our service workers. So in the first couple of weeks, we saw about 26 to 27% of the jobless claims came out of the hospitality and leisure industry. And it's only going to be higher as we start to get additional data in. We are really putting together plans right now for individuals that are not able to return to occupations that they were in prior to the pandemic. We need to start to identify resources and ways that we can get them upskilled so they can get into employment. And so we are looking at resources for that now.
All right. Well, Chris, thank you. We're gonna stay in touch with you over the next few weeks and months, because this is just going to be information that's going to continue to evolve, and services are going to evolve as well to keep helping the people of our county, city and county. And we really appreciate everything you and your staff are doing.
Well, thank you, and thanks for the support.
And once again, I want to give you that website he mentioned, guilfordworks.org, and you can text jobs to 336-882-4141. Thanks again, Chris. And we will be back with more Gate City Insider right after this. Welcome back to Gate City Insider. We are talking about the pandemic today and ways that our community is really stepping up to help and to make sure that children and families and the elderly and really everyone in Greensboro has what they need to survive and thrive during this time. And Backpack Beginnings is one agency that has really stepped up to make sure that children and families are fed. Parker White is the founder and executive director. Very good to see you again, Parker.
Thank you so much for having me.
Can you talk about those first couple of weeks from the time that we got the news that schools would be closed to, as things kept kind of unfolding and learning about the virus, what was happening at Backpack Beginnings?
Sure. That first weekend before they announced that schools closed, we were meeting with Guilford County Schools. It looked like we were heading in that direction, so we wanted to go ahead and get a plan together with the school system and with partner agencies of what feeding and providing basic needs would look like during that time if schools closed. And then that call was made during those meetings. And that next week or two, we were just working with partner agencies. We were working internally to figure out how we would be able to distribute the food. It would look differently than anything we had ever done before. So we needed to make sure that the processes internally worked well. We had to make adjustments after week one, but we were able, after a couple weeks, to put together something that we were able to sustain, and found that worked for the school system, worked for the families, and worked for us internally.
Talk about scale a little bit, because you had already been providing backpacks to thousands of students filled with food every week throughout the Guilford County school system, and this ramped up exponentially.
Absolutely. Our food pantry program has tripled in capacity since this started, and there was a huge need. Guilford County schools determine what their feeding sites would look like, and we started with about 20 or 25 of their sites, and as they added more, we continued to add more until we hit about 32 sites distributing 2,500 bags of food every single Friday. And they're now up to about 123 locations, but we're glad to be able to help at those 32 locations. We also provide at non-school food pantries as well. So we are in healthcare settings, we are in homeless shelters, we are at Guilford Child Development, feeding. So we wanted to make sure that we could sustain those programs as well. And then we've opened our warehouse to social workers and family advocates to stop by and pick up the needed basic needs that these families have: food, hygiene products, school supplies, books, clothing. We wanted to make sure that we were still a resource for those social workers to come by and pick what they needed.
I know Backpack Beginnings has a core group of volunteers who've been so dedicated over a lot of years, but that had to change a lot during this time too.
That's right. A lot of our volunteers, our regular volunteers, were in that age group that were asked to stay at home. So we were looking for volunteers to make deliveries and distributions at our feeding sites, but also come into the warehouse and help. But we needed to limit the numbers. So it was a balancing act of finding enough volunteers to help us get done what we needed to get done, but not have too many volunteers that we were not social distancing or exposing our staff to too many people. So we have been able to find that balance and to be able to make those 2,500 bags every week, but it really comes down to the wire. Every Thursday, getting those bags ready for distribution on Fridays.
Can you talk about the food? Because we know that the grocery stores, had been limits and difficulty finding some things in some cases. So did you face some of those same challenges as well?
Absolutely. That first month was really a scramble to get all the food that we needed. Like you said, the grocery stores were limiting the number of items someone could take. Also, our food providers didn't have the resources that they normally had for us. So we really had to put a call out to the community and ask for them to grab a few extra things and drop them off. So we were able to kind of piece it together by getting some of the items from our normal vendors and then piecemealing it with what people were dropping off. And it's not back to normal yet. We still aren't able to get all the food that we normally would be able to get from our vendors. So luckily, the community continues to step up and help us with that.
And you are a mom. You have kids who are in school, who are doing the homeschooling now. How are you juggling that?
It's been a little crazy. I'm sure I am not doing it perfectly, and it doesn't look great in our house all the time, but we are just trying to get by just like every other family. I have a very supportive and loving husband that has stepped up to the plate and really helped with the homeschooling. I have 2 children that understand that their mom has to work and may have to be on her computer doing work right next to them on their computers doing work. So it has been a juggle, but a lot of people are in this boat and we're all just doing the best we can.
Mm-hmm. And you are a volunteer, and you have been from the very beginning in all of this. And I know Backpack Beginnings is largely made up of volunteers. Do you still have needs for volunteers? Do you still have needs for donations?
Absolutely. So the biggest needs we have right now are food donations, monetary donations to go buy food, and volunteers to come and help out. We utilize about 32 delivery volunteers that stay and distribute the food every single week. At our feeding sites on Fridays, we also need volunteers to come into the warehouse to prep those bags. We will continue to make thousands of bags every week, so that does take hands and volunteer time. We're continuing to keep the numbers relatively low, but we hope that we can just slowly increase those. And yeah, absolutely, there's needs for all of those things. And the community, like I said, has really stepped up, and we hope that they can continue to help us to get through this summer.
Well, I know they will. Parker, what is it that drives you?
I just have a real passion for children. I can't imagine. I don't want a child to worry where their next meal is coming from. I don't want them to be embarrassed by the clothes they're wearing or what their hygiene may look like. I just want them to enjoy being a child. So if we can take away some of those basic concerns that they may have, that's all I want. I feel very passionate about that, and I'm just glad we can play a role during this time.
Thank you, Parker. How's the best way for folks to stay in touch with Backpack Beginnings and learn about some of these volunteer and donation opportunities?
So the best way is to visit our website. We have a lot of information on there, and visit the blog on our website called COVID-19 Response. We're constantly keeping that updated about our greatest needs for food, our needs for volunteers, and other ways people can help.
Parker, thank you so much. Great to see you.
Thank you as well.
You can keep up with the City of Greensboro's response to COVID-19 by following us on our social media channels or by going to our website, greensboro-nc.gov. Then click on COVID-19 information and updates, and you'll find everything you need to know about the changes that are happening over the next few months as we all navigate this very difficult time. Thank you so much for joining us for this edition of Gate City Insider. We will see you next time.